You're all so quiet. Is this really the LCA? Or am I in the wrong room? Hello, everyone. It's great to see you again, and I thank you for coming in person. Just for the record, everyone here is vaxxed. Everyone here is boosted. We're 6 feet apart. We'll keep our masks on when we're not speaking, but I want, in the interest of making sure everyone can hear me, I'm going to invoke the rule we have in place for people who are using microphones. So just so you know, all the rules have been followed here. We just wrapped up my very first cabinet meeting, and it was such a privilege for me to see the individuals, the very diverse individuals from all walks of life, and gender diversity, racial diversity, cultural diversity, who have become part of our team. And I'm really energized by what they bring to the experience of reshaping state government. And as I said on the first day in this very room, it is my highest priority to restore people's faith in state government. And they are the dream team that are helping me execute that every single day. We had a chance to hear from Lieutenant Governor Brian Benjamin on all the initiatives he's working on, whether it's public safety, eradicating gun violence, dealing with the housing insecurity crisis we have, and I want to thank him, and also economic development initiatives. He has a lot on his plate. I've challenged him to beat my record in miles around the state, so he's on track to do that. He's been everywhere, and I thank him for his friendship and his partnership, our Lieutenant Governor Brian Benjamin. Also, we heard from Robert Mujica on our budget priorities. As everyone knows, our budget is due in a matter of weeks. We'll keep to that proper schedule, as well as giving us an analysis of our fiscal condition right now, and how we're heading into an uncertain time, particularly with the variants spiking again and creating more havoc than we had anticipated. But we now will have the reserves in place to be able to deal with whatever comes our way, and that was an important priority of mine, to make sure we have the resources to deal with the future challenges. I also had a chance for my administration to hear directly from Dr. Mary Bassett, who is an extraordinary individual leader who has tremendous service in the city of New York, and we were able to pull her out of a very nice position at Harvard to join our team. And when she said yes, I knew that we would have someone who is a very confident leader, but also an inspiring leader, and I want to thank her for her work. And I asked her to give an update then, and because it's so important in light of the Omicron variant and what is happening all across our state, no state is untouched by what we anticipate will be a very serious situation. Not something we haven't spoken about, it's not something we haven't warned about, it's not something we haven't prepared for. However, it is upon us. That winter surge is in full force, and I believe it's going to get even stronger and more virulent, and we are in for a rough ride this winter season. So I've asked Dr. Bassett to speak then, but I wanted to have her present to you a synopsis of what she shared with us, just so you have the data in real time with when I was briefed. And Dr. Bassett, if you could share some of the highlights of your presentation, I'd appreciate it.
Thank you very much, Governor. So I'm going to start out with this graph, which really shows where we've been in the last couple of months. I hope that you can read it. Some of the print is a little bit small. But in the summer, after having sort of had a lull in transmission and beginning to open up, which we've continued, we began to see this, what we now call the Delta surge, a new variant that was first described in India. It was the 4th variant of concern, according to the World Health Organization. And now we're at the winter surge, something that was anticipated because as the weather gets colder, more people go inside, and also more people were mixing in ways that they didn't do a year ago. So the winter surge has been substantial. We have seen levels, if you compare the level of hospitalizations, that's what the red line is, on December 14th compared to where it was back in July, or even at the peak of the Delta surge. You can see that hospitalizations are the highest that we've seen in months and are still going up. At the same time, that line at the bottom shows the rate of increase of vaccination. Just to give you an idea of the numbers, as this winter surge began, we went from 65 to 68% of the population fully vaccinated. And that dotted line just shows that we've had a flattening out of the rate of uptake of vaccinations. I hope that all of you are vaccinated. I recommend that everyone be vaccinated and boosted. We've seen a little uptick recently that I think reflects the efforts of the governor, my department, and the occurrence of the concern about new variants. Let me show you this at the risk of acting like a math teacher for the press. This shows you what happens with exponential spread. In the green are something equivalent to the Delta variant that we think each person can infect 1.5 to 2 people. And if you look at the bottom there, in 10 cycles, that means 10 cycles of transmission, you get up to 2,000 cases. With a more contagious variant, the difference in the total number of people infected becomes really huge. Say each case infects 4 people. At the end of 10 cycles, you have nearly 1.4 million infections. Now think about how serious this virus is. Say that 10% of people infected end up hospitalized. That's at the bottom of the new admissions line. There you get about 200 cases, but in contrast, if you have so many more people infected, this goes up to about 14,000. I was inspired to show you these data because these type of data, and to show the cabinet these data because these type of data were shared by the president of Cornell University. So this sets me up to talk about Omicron. And we are keeping an eye on what's going on in the rest of the world. Here we have data from Norway and Denmark, highly vaccinated populations with an age distribution more like the United States than South Africa. Look at the peak there. These are new cases, so this is infections, not hospitalizations. But we know that even if it's much less likely to cause severe disease, which seems to be the case, if you have a lot of people infected, even a small proportion will lead to big numbers. And of course, we're also in flu season. And I have to always use the chance to remind people that they need to get both vaccinated for COVID and for flu. When everybody was sort of living very constrained lives, we hardly saw any flu last season. But this year, we're already ahead of where we were in the last big flu season 2 years ago. So we're concerned also about flu and the fact that we have both of these in our midst. So that's where we are. We are in the midst of a Delta surge. We have Omicron in the wings. It's been identified here in New York State. And we also can't forget that with winter comes seasonal influenza. Thank you, Governor.
Thank you, Dr. Bassett, for sharing that. And just as far as our regular update goes, we lost 71 New Yorkers yesterday. Heartbreaking experience for families, particularly heading into this holiday season, and our hearts go out to them. And the numbers statewide continue to rise. The hospitalizations continue to escalate. And our vaccinations, not quite plateaued, but I want to make sure everyone knows that particularly individuals who received their first vaccination early on, and these are the people who lived in assisted living and in nursing homes and who were immunocompromised, they may have been vaccinated back in December, January, February. You need to get that booster shot because otherwise you are not nearly as protected as you need to be against this new variant. And I thought the point that Dr. Bassett made was really important. People are underestimating the power of Omicron because they're saying, well, people aren't getting really sick. They're not in hospitals. Look at the percentages she just showed us based on that graph. You may only have 1% of people infected hospitalized versus 10% from Delta. But if you have 1 million more people infected because it spreads so much more quickly, that means you'll have overflowing hospitals at this rate. That was not the reality. She showed you what could happen, but she wanted you to see clearly what an exponential transmission looks like. So that is why people are saying it's not that big a deal. It's going to spread to some people who have not been fully vaccinated, or they didn't get the booster, or they may have just received their vaccine this fall, which is still effective, but at some point it'll wane. And that is why we are taking very common sense, simple measures like wearing a mask, which I know I'm going to get questions about, and go ahead because I know it's coming, but this has to be the least intrusive thing that we can do. We're asking people to follow common sense, get vaccinated, get boosted. Please don't take a chance. Please don't take a chance. You know, we've lost members of our extended family for people who just refused to get vaccinated on principle because they thought there was some sort of affecting their personal liberties and freedoms. People have a right to stay alive, and people that you affect have a right to live as well, and that's something we all should remember. So I want to thank the press for reminding everyone how important this is. Your intense coverage of this is critically important so people know what we're heading into, and I thank you for that. Again, lastly, on the it's 20 days from now, I'll be delivering the state address. It'll be my first. I'm very excited to do it in the legislature. I've heard from countless members of the legislature who remind me that it's technically not a state of the state, it's called a message to the legislature. So returning it to the home of the legislature is the right thing to do. And also, it'll be much more scaled back because of this pandemic. We hope it to be a different dynamic, but just as I was disappointed not to be able to have my cabinet meeting in person to have everybody get to know each other better, we'll also have to suspend the normal activities around the state message to the legislature, and we'll renounce what that's going to look like, as well as making sure we have policies in place for people coming into this building. I had a meeting with the leaders of the Assembly and the Senate just recently to talk about making sure we have a policy in place, certainly before we invite people back at the beginning of next year. So stay tuned for the details on what that'll look like. Again, we have a very evolving situation here. Not that we're surprised, not that it was unexpected, but it continues to be as bad as we had expected, and that's what we're dealing with right now. With that, I'll be happy to take questions. Karen?
I wanted to ask you a question about the mask mandate. A number of counties aren't enforcing it. That seems to be kind of controlling the narrative about that right now. I'm wondering if you've given any more thought to having some sort of inspections go in selectively and perhaps show that it actually is a mandate and people should follow it.
Well, I think we're focusing on a few outlier counties that have declared their resistance to following health laws. The vast majority of people are following it. And even within those counties, there are plenty of businesses and individuals doing the right thing. And I believe that the focus should be on those stories to make people think that this is not the Wild West, that there is compliance. And I thank people for that. This was never intended to be heavy-handed. In fact, the best way to do this is self-enforcing. That means the people who go out into the community, once you leave your home, you wear a mask when you walk into a facility, or a mask determines if everyone's vaccinated, they don't have to wear a mask. I wanted to have that flexibility. So perhaps as the numbers start getting higher and these counties that start refusing to follow this mask mandate, which will protect lives, they start seeing their hospitals taxed even further. They start getting anxious. They may change their minds, but it's not up to them. It's really up to the people and the businesses. And I thank all of them who have stepped up and said, we're going to do the right thing.
No health inspectors.
Pardon me?
No health inspectors right now.
I have my health inspectors very focused on making sure we have all the data in real time. We ordered another 1 million. I just received 1 million test kits. We're setting up a portal so people can request delivery of home test kits to their homes. The people who, for whatever reason, don't want to get a vaccination, that we're making sure that they at least know if they're contagious, so they have the sense to stay home. So we have them deployed in vaccination sites, testing sites, booster sites, schools, and I need my health team focused on that.
If the numbers follow the trends that we saw here with Norway and Denmark, what are the next steps for the state after the mask mandate? What's next on the list of things that you would like to implement to try to curb this spread that looks like it could get out of control based on that?
Well, I've been focused primarily on hospital bed capacity from the beginning. Even before this got bad, we're going to continue finding ways to bring in more healthcare workers to supplement. It's not a shortage of beds, it's people to staff the beds. And I may have to make some accommodations and regulations related to capacity that I have at my disposal. I have said all along I have two missions. One is to protect the health of the people of New York. The second is to protect the health of the economy. Right now, we can do both. And to the extent that businesses follow what we ask them, only allow in people who are vaccinated, and at some point, we may have to determine that fully vaccinated means boosted as well, and we'll give people the sufficient time frame to make that happen, but I'm just sending out the message now, prepare for that. We'll get more data. I'm not going to sit here and make up a new policy on that front without having it more thought out, but we'll present that probably very shortly. Also, just really encouraging people to get tested frequently. So we know what can happen. It is my strong desire to not have a detrimental effect on the economy, because the businesses that were knocked down to their knees last year barely came back, and some of them just stayed alive because of generous support from the Biden administration and policies from out of Washington. We don't even know that that money is going to be there again. You know, the life support that many were on, we've had our own programs to support them financially, small businesses, Broadway, the hospitality community. So I'm also looking at all the economic development help we could give to help them stay open, or if they have to scale back their operations. But right now, I'm having at my disposal maximum flexibility. I know all the levers I can pull if necessary. My team has been ready to do whatever's necessary to protect people of this state. And the number one easiest thing in the world to do is get vaccinated and get boosted, and also wear a mask, because there are cases of reinfections. People who have been vaccinated are getting it again and again, and they may not be in a hospital, but they can also be in contact with someone who does end up in a hospital. That's what Dr. Bassett was talking about.
Governor, on the at-home COVID test, will it be feasible at some point to send an at-home COVID test kit to all 20 million New Yorkers? And to follow up on the staff bed issue kind of separately, some hospital executives, some nursing home facility managers have said that one of the big hindrances to hiring has been a lack of pay increase for a number of healthcare workers over the years. Is that something that's feasible as well?
You'll see in my State of the State address a comprehensive look at how we can increase the healthcare workforce. It was declining even before this pandemic, and as a result of this pandemic and the incredible stress that these angels on earth have been through, and they've been through so much, and they're exhausted, they're exasperated. They don't know why it's going on this long, because they know that people could have gotten vaccinated and get boosters, and to help save them from having to have work overtime and long shifts and all this. I've been in these situations. I was in a hospital and saw what these people are going through, and God bless them for what they do every day. But yes, they need to be paid more. Yes, we need to have more training programs. We have a program right now to train 1,000 new nurses, full expense covered by the state of New York, just to get more people in the pipeline. I've had countless conversations with the leaders of nursing homes, long-term care facilities, hospitals, and this is the point, the crisis point. I'm trying to working with Washington to get visas allowed for people to come in from other countries. Got one facility that's looking for 122 visas. I called Washington. We're trying to hit this from many approaches, but you are correct about the loss of individuals who've gone elsewhere for employment or gave up on this, and I treat this this is one of the highest priorities in my State of the State to address that. And I don't plan to mail 20 million kits to people. What I'm going to do is do micro-targeting to find out the areas that have the least number of people vaccinated and higher rates. That's what we're tracking. So they're also available in stores. And one thing I announced recently is that your insurance company now has to cover the cost of you buying that testing kit. The price points are starting to come down. At one time, there were only 8 companies that manufacture them. Now there's 13, so there's more supply out there. They're available on shelves. They should be. We also want to get them into schools for kids as well, so we can keep children learning. And that is so important to me, that we keep kids, and the kids have been wearing masks from the beginning. The kids are doing fine. The kids are safer, especially those whose parents have had them get vaccinated. And I encourage everybody, between the next few weeks, please get your children vaccinated. It was wonderful news for all parents to know that 5-year-olds on up, and I'm hoping that it even goes lower, but there is no reason why children are not vaccinated. So we are addressing it from many fronts, Nick.
Question on voting rights. New York is going to have an automatic voting registration system. They're going to have a public matching system. civic rights organizations are calling on you to ensure that there's going to be adequate funding for that. Is that something you can commit to? And also, do you intend on making democracy and voting rights a part of your agenda in 2022 and beyond?
Yes, I do. Very much so. We've had many conversations along these lines. A high priority of mine, particularly the assault on voting rights that's going around the country. I want them to know that New York State will be a leader. We have not been a leader in the past. We have made it too hard for people to vote, even something as simple as early voting. Why did it take so long? I believe that everyone should be able to vote by mail. That is a radical proposition to some, and others, it just makes sense. Why are there barriers to people exercising the most basic right of a democracy is for people to elect the leaders they choose? It's been successful in other states. It's been successful in Oregon, where they have about a 98% participation rate in elections. And so I'll be working with all of my partners to come up with a very bold and ambitious plan to make sure that New Yorkers have the right. And if there's money required behind it, everyone knows I'm not a big fan of unfunded mandates. This is radical coming out of New York State, but I was on the receiving end of many of those mandates. So the extent that we're going to be asking our boards of elections to do more or undertake more costs, I believe that the state of New York should have a strong role, and that's being worked out as well.
Doctor, this COVID wave has been described by many people as kind of a pandemic of the unvaccinated, but we're seeing with Omicron, it obviously can affect people who have been vaccinated. How important is state response to this ongoing surge is it that vaccinated people get tested regularly?
That's an interesting question. I mean, our main message right now to people who have been vaccinated is to be sure you get boosted. It seems clear. The preliminary data make it clear that being boosted, and this is from other countries, will help protect against the Omicron variant. But we haven't really, I think you've heard the governor talk about an increasing deployment of testing as an additional tool in confronting this pandemic. We do know that people who are vaccinated can become infected. People who've have survived COVID and have been previously infected can also be reinfected. So stay tuned on that one.
This one's both for you and for the Lieutenant Governor. Bail reform is going to be another topic of discussion for the upcoming legislative session. Curious about what both you and Ryan Benjamin think about the dangerousness standard that's proposed by law enforcement. They want to completely get rid of cash bail altogether and only remand people based on an assessment by a judge of their dangerousness. Your thoughts on that, and you as well.
We are certainly looking at all the policy options, and as those of you who are getting to know me will know that I'm not going to be crafting legislation sitting at a press conference, and it is a conversation that I've already had with our legislative leaders. Our main focus is public safety, protecting people where they live, and finding all the opportunities to do that and make sure it makes sense. So.
Sure. Look, can I finish? Can I speak? Sure. First of all, I want to say that the governor is spot on this. You don't do legislative negotiation in the media. There have been and will continue to be conversations with the legislature, and look forward to what the right decision is, which leads to most public safety. Public safety is the key issue. We want to be fair. We don't want wrongful incarceration or anything along those lines, but we want to make sure that we have safe streets and the public is safe.
On the mask mandate, you mentioned the economic impact on businesses. We've already seen some impacts on gyms, for instance, and this is right before the holidays. What is your message to those small business owners that say that this is going to crush them because people don't want to wear a mask into a gym? And is there any end in sight to this? I mean, will you create a metric that says when this many people get vaccinated or when we see hospitalizations at this rate, we'll end this mandate?
I'm just curious, has anybody heard what I've said today about the situation we're in? This is a crisis. This is a health care crisis, and people are going to die. That is not hyperbole. That is based on the facts that are in front of us right now. If people had gotten vaccinated when we asked them to and got the booster shots, I wouldn't have had to put in place a mask mandate, but it is a mask or vaccine option, give maximum flexibility, And I go to a gym when I can. I wear my mask. People in the gym wear a mask. And we're all happy we have the chance to even have a facility that is open. Let me restate that. The facility does not have to close. A year and a half ago, they were shut down. That hurt them economically. That is not the place I want to go ever again. I do not want to have that happen. So I think the media could do a tremendous service to helping people save lives if they remind people that this is a simple act. To wear a mask when you're working out, to wear a mask when you go to the grocery store, wear a mask when you're in line to get the extra tinsel and the hooks for the trees you forgot, and when you're shopping for your dinner. It is so simple, and if we could get the refocus on this, as opposed to the outliers who say they're not going to do it, what happens when they end up in a hospital and they've been on television saying, I'm not going to enforce it? Those healthcare workers are going to just look at that person and say, you know what, it didn't have to be this way. You didn't have to be there. So I'm trying to disinject a sense of calm, a sense of responsibility, not an overreaction, but just say, it's a simple matter. Let's get through these holidays. Let's get through this crisis time. We saw the numbers. We do not want to be Denmark. We do not want to be Norway. And we, because we have widely available vaccinations that the rest of the world is envious of. They cannot understand why every single person in this country is not vaccinated when it's been available. And so that's what I say to those people. When you say to me, what do you say to those people? I say, please put on the mask. In the long run, your business will be better off not having to ever go backwards where we were before. So thank you. One more.
Excuse me, I'm asking a question. It's my follow-up. But
Governor
the fact of the matter is not everyone will get vaccinated. So when will this end?
Take a breath. No one could have foreseen that we'd be even dealing with the Omicron variant months ago. There is no person on this planet that can give an answer to the question, when will this end? Nor can I. That's my answer today. I do not have an answer. This is a public health crisis. It is not a decision of state government to create this. Therefore, I do not have direct control. But I will always assure the people of the state that as their governor, this is my highest priority to keep them safe. And I'll do everything in my power so that parents know that their kids are protected when they're in schools. You go out to a restaurant, you go out to a gym, that you are safe. So our simple, very basic policies will do just that. I cannot predict the end, but nobody can. Last question.
Governor Hochul, if you could please speak on the recent update on the regulations from the Office of Cannabis Management. Can you please speak on the updated marketplace to CBD as well as just where that office is in progress?
And again, I was very happy. One of my first actions as governor, just a little over 100 days ago, was to unleash the great potential of that by naming the individuals who are the leaders of the Office of Cannabis Management, as well as an advisory council. There's a lot of energy behind this, a lot of interest in getting this done. I am very impatient. I want this done now. They're working on the regulations. They had to staff up. They had to get space. I've also said, whatever you need to be successful. I've told them that. So the timing is they're working on regulations now. They'll be out very shortly. We're going to staff up, make sure that everything is ready to go. And I cannot wait to unleash the great potential of a brand new industry that is going to help everybody from our farmers upstate to our hardest hit communities of color that were so indiscriminately, well, I should say discriminately impacted by over prosecution on low-level marijuana offenses for decades. And so there is going to be a sea change in this year. And especially as our economy is still a little bit unsteady now with this pandemic, it's an opportunity for the farmers to start growing, for the distribution network to be established, the retail licenses to be granted. So it's very early, but I look forward to presenting a more wide-scale timetable for all of you, because I know there's a lot of anxiety. And I do want to say one more thing. Thank you for what you do. I really appreciate the role that you play. I have tremendous respect for the media. I know it's a sacrifice many times. You're working on a story last minute. You want to be with your family, you have other plans. And so I do hope that over this holiday season, you get a chance to recharge, take a breath, appreciate each other, because in America, there are 800,000 fewer loved ones than we had at the start of this pandemic. And never let us forget. Let's keep them in our hearts and prayers as we go through this holiday season and make sure that all of us are able to return safely. Thank you.